Today we are going to continue on with the rest of the ankle and foot anatomy. So again, as always, just making sure that you are taking notes. Right now we're going to talk about the articulations of the foot. So articulation is just a joint. So a joint too, if you don't remember, is where two bones are meeting. So you have several articulations in your foot, and a lot of them are coming from your toes. And so if you remember, each little segment of your toe is a bone and it has a specific name. And so just remember that between those bones where they connect, that is a joint itself. So again, we're just going to talk about that. So you have your interphalangeal joints, which is what I was talking about. So those are the joints in between each section of your phalanx. You have your IP joint, your pip joint, and your dip joint. So these joints are named after where they are related. So the IP is the interphalangeal joint. Your pip joint stands for proximal interphalangeal joint, and then your dip is distal interphalangeal joint. So this is where you need to start remembering what proximal versus distal means. So if we're looking right here, and I know this image isn't the best, but you have your interphalangeal joints right here, and then you have your metatarsal joints. So your metatarsal joint is where your metatarsal bone connects with that first phalanx. If something is closer to your body, then that is your pip joint. So that's where your pip joint would be. Remember, your great toe does not have an interphalangeal joint, so that one in between. So you would just then have a dip joint. So that is the dip. If we go to the other toes, though, that have all three, that is where you would have your pip, because it's proximal, your ip, because it's intermediate, and then your dip, which is distal. So again, don't expect you guys to have this all memorized right now, but just know that each little segment of the bone has joints as well that connect it to other parts of the foot. You then go into your metatarsal joints. So right here, so that is where the pip and your metatarsal connect. So that's your metatarsal phalangeal joint. Then if you continue going closer towards your ankle, you have the joints in between your different tarsal bones. And so that is where your metatarsal and the tarsal bones start to connect. So that's the intermetatarsal joint. So again, a lot of the joints and ligaments are named after what they're connecting. So if you can remember that, that can kind of help you where the location of the different joints are. And then you have your tarso-metatarsal joint. So that is where your tarsal bones and your metatarsals are connecting. And then you have your subtalar joint. So that is the joint that essentially connects your talus and your calcaneus. So sub means below. If we go back to medical terminology, talar is pertaining to your talus. So it is below your talus. So again, not the greatest image right here, but talus, if you can imagine, is right here. And then you have your calcaneus that sits underneath that. So that would be your subtalar joint. And then above that, getting more towards your lower leg, that's your talocrural joint. So that's where your talus is connecting then with your tibia. Your fibula is making contact with that as well. And again, this kind of goes into it. So I just mentioned your subtalar joint is where your talus and your calcaneus connect. So again, calcaneus is your heel bone. Talus is a bone that sits above that. And so you have ligaments that connect these two. Some of the ligaments that you commonly sprain are ones that connect like your talus to your calcaneus and your fibula to your talus as well. Just above that, like I mentioned, you have your talocrural joint. So this is a joint right here where you have your tibia, fibula, and talus connecting. So it's also sometimes called the ankle mortise or tenon configuration. I have never called it this, but I have heard it as ankle mortise. So just know ankle is going to be these three bones, and it's also known as a talocrural joint. Talus is a wedge-shaped bone, and so I've also heard that it's like a dome-shaped bone. I personally have not seen my talus. Obviously, we need to look at it through like an MRI imaging, which I believe this looks like an X-ray. But anyways, the shape of it allows for your foot essentially to be able to move into dorsiflexion and plantar flexion. So that movement where you're bringing your foot towards your head and then plantar flexion is like when you're pointing your foot downwards, like you're pressing on a gas pedal. So that dome shape allows you to have that movement. And then again, just a reminder, your lateral malleolus extends further or more distally than this medial malleolus. So lateral malleolus is right here. It's part of your fibula. And then medial malleolus is right here. And that is your tibia. So again, remember, if you're looking at your ankle, the parts that are bony and stick out, those are your malleoli. And then you have your obviously names for your medial and lateral. And they're not separate bones. They're connected to your fibula and then tibia. You have arches in your feet as well. And so your arches are intended to support your body weight. So we'll get into different foot pathologies, so conditions that can affect your foot that could potentially lead to different like medical conditions. So like pes planus, which we haven't gone over before, is a flat foot. And so people with flat feet tend to have greater chance of getting like shin splints or stress fractures. Not saying that if you have flat feet, you're going to have that happen, but they're just going to be more likely to have that happen because they don't have the arch that they should have, because your arch needs to support body weight, so they're unable to support it the correct way. And so just know your arches are intended to support your body weight, the forces that you're applying on it, so running, things like that, movement changes. And then also the arches allow for space so that your blood vessels and tendons and muscles can kind of articulate to where they need to go. You have 4 different arches in your feet. You have your metatarsal arch. So this is the arch right here that you, if you were looking like at the bottom of your foot, you would see where your toes are connecting to your metatarsals. You then have behind that your transverse arch. So this is where your metatarsals and your tarsal bones connect. That's kind of where you will see that you actually have a type of arch. It's usually where the peak of that arch is your transverse arch. And then you also have arches along the medial side, and then you have arches along the lateral side as well. So they're just named after essentially where they're located. So the metatarsal arch is obviously where your metatarsals are. Transverse arch, not so much, but that one's going to be just knowing where it's where your metatarsals and cuneiforms connect. And then the medial longitudinal is going to be medial side, lateral is going to be lateral side. And then this is just another image of some more, I guess, a better view for you guys to see the different arches in your foot. You also have what is called plantar fascia. So we're going to get into a little bit more of the soft tissue parts of the foot. You have fascia all over your body. Fascia is basically a type of tissue that covers your muscle, and it's kind of in between. It's web-like, so it kind of just meshes in with your muscle. And the fascia itself can get irritated. Like once we get into, again, the medical conditions that can be associated with sports in the foot, that fascia is intended to just cause more support in the foot, in the arch, so that you're able to withstand the forces of your weight, which would be like those downward forces, especially like when you're running and doing movement. And just know that this fascia or this type of tissue starts from your calcaneus and goes all the way to your metatarsals, all the way to your phalanx. You have little muscles within your foot. This is why we have doctors that specialize in the foot, just because there's so much going on anatomically in the foot. So the podiatrists, obviously specialize in this. And that's kind of the same thing when we get into the hand. The hand and the feet have a lot going on, and that's just because there's so much that these areas of your body need to do. With your hands, you have your fine motor skills, so you need to have a lot of little small intrinsic muscles to allow for that, but your feet do as well. So you have your extensor muscles and your flexor muscles. Again, do not expect you guys to have all of this memorized, but just know that the muscles on the bottom of your foot are known as your flexors. So if you want to try this out, if you were to curl your toes right now, and let's say you had shoes on, maybe take them off. If you were to curl your toes right now, and have your hand at the bottom of your foot, you should feel some type of contraction. So your flexors are on the bottom of your foot. Opposite of that, on the top side of your foot, if you were to bring all of your toes back, you should feel some sort of contraction too if you have your hand on the top of your foot. and those are your extensor muscles. So just know toe flexors cause your toes to curl, toe extensors cause them to come backwards. And then you have a great toe and fifth toe abductors. So abduction, remember, means bringing it away. So if you can imagine, if you're spreading your toes apart, you have muscles that allow for that. And then you also have muscles that opposite of that bring your toes together, and that's adduction. You also have muscles that help to innervate your lower leg. So these are the larger muscles. If we go back to this one, intrinsic, these are going to be the smaller muscles. Extrinsic are going to be the bigger ones. And so how the lower leg and foot is divided for your extrinsic muscles is through compartments. So again, I do not expect you guys to have all of this memorized right now, but just know that there are 4 compartments in your lower leg, and they are named anterior. So obviously the anterior compartment is going to be in the front. You have your lateral compartment, which is going to be lateral side. You have your superficial posterior. So this is closer to the skin and it's on the back side. And then you have your deep posterior. Deep means further in, and it's going to be more here. And then this is just a better image. So again, just a reminder, your tibia is that bigger bone. It makes up your shin, and then your fibula is a smaller bone, not as much weight bearing, and it is more lateral to your tibia. And then again, these muscles we've kind of gone over, at least the superficial ones when we went over the muscles at the anatomy review at the beginning of the school year. But just don't forget your this stuff you definitely will need. These ones, not as important. I don't expect you guys to have those all memorized, but you should know that your gastrocnemius, your soleus, and your plantaris all make up your calf muscle. So calf muscle is not the correct way to say a muscle. It's just a general way of saying it. The gastrocnemius, soleus, plantaris, those are all the muscles that make up your calf. And you will need to know this stuff for when we get into more injuries, and then also how to assess for them. All right, so you have the muscles and tendons of your anterior compartment. So right here, you have your tibialis anterior, your extensor hallucis longus, and then your extensor digitorum longus. So those all super long names. The extensors, again, remember, they're going to be on the front side of your foot and body, or lower leg, sorry. Hallucis is pertaining to your great toe, because hallux is your great toe. And then digitorum is pertaining to the digits. So sometimes you'll hear fingers are known as your digits. Toes are the same as that. So just know the extensors are on the front side. Tibialis is obviously pertaining to your tibia, and then it's on the anterior side. And just know that all of these muscles help to dorsiflex your foot. So they help to bring your foot back if you were to try to make it like a 90 degrees. You then have the muscles on the lateral side. So these ones are called your peroneus longus and peroneus brevis. So they are on obviously the lateral side, and they allow you to evert your foot. So foot eversion is when you bring your foot outward. So they allow for the movement of this foot to come outward. You then have your superficial posterior compartments. Like I said, these are commonly known as your calf muscle. So this is your gastrocnemius, soleus, and plantaris. They then have this tendon that comes down, and that is your Achilles tendon. And this muscle allows you to plantar flex your foot. So like I mentioned, plantar flexion is like pointing your foot downward. You could also think of it as standing on your toes. That these muscles are going to allow you to have that ability to stand on your toes or point your foot downward. You then have the muscles of your deep posterior compartment. So you have your tibialis posterior. If we go back to the anterior compartment, you have tibialis anterior. So again, this muscle is named after the location that it is found. So this is going to be on the posterior side of the lower leg. Imagine if you were to remove the calf muscles. So your gastrocnemius, your soleus, plantaris, these are going to be the ones that are more deep inside. And you have your flexor hallucis longus and your flexor digitorum longus. So it's very similar to the anterior compartment. It's just instead of extending it, these muscles allow for flexion of the toes. And they also help with plantar flexion as well. And then they also allow for eversion of the foot, so bringing your foot inward. And then last thing we'll go over is just some neurological and vascular things that you'll need to know. And we kind of have gone over this when we went into the pulse lab, I believe from last year. But you do have a nerve that is on the posterior part of the leg and plantar aspect of the foot. So what that means is it's going to be located kind of around here. And that is known as your tibial nerve. And then you have a nerve known as your common peroneal nerve. This one is anterior on the leg and it's on the foot. So you can actually see right here where it's located. But that one innervates the front side or top side of your foot, dorsal part of your foot. And then you have blood supply. So this is kind of where I was going with the different sites that we learned with our pulse lab from last year, if you remember. But you have arteries, obviously, throughout your body. Arteries are where you're able to detect pulse on someone. And so in the foot, you have your anterior tibial artery, also commonly called your dorsipedal artery. I believe that's what I called it when we went over that lab. And then you have your posterior tibial artery. So the dorsipedal artery is the one that's located kind of over here. I usually say that it is between your great toe and your second toe, and then slightly back about an inch. And then you have your posterior tibial artery. So this one is actually going to be on the medial side, kind of right next to your lateral or medial malleolus. Sorry, not lateral, medial malleolus. And so this is just kind of an image of that. So again, this is the right foot. This is on the medial side. You'll right here, his hand is covering it, but that's the medial malleolus. So you're putting your fingers essentially between the medial malleolus and then that Achilles tendon. And then the dorsipedal pulse is right here. So again, I usually reference it as in between your great toe and your second toe, and then about an inch or so back. All right, we will stop there for today. And as always, just make sure you guys turn your notes in before the end of the period, and then we will continue on with this on Monday.